Hi everyone, my name is Rita. I'm one of the pharmacists here at HB Pharmacy, and today I'm going to be talking to you about your osteoporosis medication. Osteoporosis is a condition of the bones that can cause them to be thin, brittle, and break very easily, almost porous-like. Some common symptoms of osteoporosis that you might feel are a bit of back pain or arm pain, some slight curvature or hunching in the posture, and just an overall feeling of tiredness. So if you're experiencing any of these, it's really important to call your doctor and have them run a few tests to see if you do in fact have osteoporosis. So once you go to your doctor's office and they say that you do have osteoporosis, they're going to prescribe you a couple of medications, and that's where we come in here at HB Pharmacy. So it's really important to know what you're taking, how it works, and what some side effects are. How you can prevent these side effects is also very important. So one of the medications most commonly prescribed by your doctor is going to be a medication called alendronate. That's the generic name. The brand name is Fosamax. And typically the medication is dosed at 70 milligrams one time once a week. So it's really great. You get 4 pills for a month at a time. The medication works by keeping our bones in equilibrium, our bone cells in equilibrium between their breakdown and their formation. When our bones have this equilibrium, then we have very healthy bones. But oftentimes, in the case of osteoporosis, sometimes bone breakdown is higher than the way that our bones form. So it's really important to have medications like alendronate, which can keep our cells in a nice balance between the two and keeping us having healthy, good bones. So another medication in the class is also risendronate. This one is about once a month. It's less commonly prescribed, but also a possibility. So speak to your doctor about that. So it's also important to talk about some side effects of alendronate, or like I said, Fosamax. So some of the side effects and how to avoid them is pretty simple. The medication needs to be taken on an empty stomach. First thing when you wake up is best, with a full glass of water. And this is to help avoid any type of disruption or irritation in the esophagus, which could be possible with this medication. So like I said, on a full glass of water with an empty stomach, and to not lay down half an hour to an hour after taking the medication. It's important to be sitting upright and not laying down, again, to prevent that irritation in the esophagus that's possible. Another thing with this medication, it can cause some issues with the teeth. So it's very, very important to keep your hygiene up. Brush twice daily, rinse your mouth out effectively, and also avoid any dental procedures while you're on the medication. If for some reason you have to go for a dental procedure, talk to your doctor first and ask them if you should pause or hold off on the medication a couple days before you go for your procedure. Now, another class of medications is called Prolia. Prolia is another medication. This one is not oral though, it is an injectable, and it is once every 6 months. It works in the same way that alendronate or Fosamax work, and so you're going to have the same side effects to look out for. Make sure you're still talking to your doctor about any dental treatment that you're going on, and just be mindful of overall hygiene and bone health. So in addition to taking your medication, it's really important to do things that we call non-pharmacological, or instances that don't pertain to medication, to help with your bone health. These can include casual or daily supplements that you take, which would require the input of your doctor as well to make sure that your levels are within range. So if the doctor recommends a calcium and vitamin D supplement for you, any of these are good. This one is 1 to 2 tablets depending on what your recommended dose is by the doctor every day. This one contains the calcium known as calcium carbonate, which is the highest percentage of calcium per tablet. That's 40%. So it's really important to also take this medication with food and water. It can help with any digestive problems that you may be experiencing. Another great one to add is K-Force. It contains a supplement or an ingredient known as vitamin K2. Vitamin K2 has been studied more recently, and it's been shown to also help with that balance that I was talking about earlier in our bones. It helps support the bone formation and helps prevent the bone destruction. So it's also really great for a supplement to be taken with your alendronate or your risendronate, like I said. So in addition to all the supplementation, it's also really important to increase your vitamin D and your calcium absorption through your foods. So foods that are dairy, egg yolks are really great, salmon, and even looking in your aisles at the grocery store for any fortified foods that contain increased amounts of calcium and vitamin D can also be really, really great to help you with your bone health. So again, if you have any questions about your medication or anything you can do for lifestyle modifications, please give us a call at HB Pharmacy. Thank you.